I have 6 deaf family members, including my mother in the orange. This means that I'm a child of a deaf adult, also known as a CODA. While I'm a nurse practitioner and a diabetes researcher now, my first job was a child interpreter. I have this interesting lens of being a clinician scientist who grew up in deaf culture. I'm part of this health system that saves lives and helps people be as healthy as possible, and also part of the same healthcare system that consistently fails my own deaf family members. You see, the healthcare system has been built for hearing people who speak English. Deaf people are not included in the design of healthcare, and in fact, accessibility is an afterthought. Let me give you some examples. Many deaf people in the United States communicate using American Sign Language, or ASL. But ASL interpreters are only scheduled 50% of the time when they're requested by someone who's deaf. And when they do show up, they're not always trained to interpret medical jargon that we know happens in the clinical setting. Do you remember that game called Telephone, where you say something in someone's ear and then it gets passed on to the next person? Sometimes that message gets lost. Now, imagine that your message is getting lost at a medical appointment. You're trying to communicate something to them, or they're trying to communicate something to you, and it's just not working. That would be so scary, especially when your life is on the line. If an interpreter doesn't show up, sometimes a clinician might assume, oh, I can just write notes back and forth with you in English. However, a deaf person's primary language is ASL, and ASL is totally different language from English. It would be like Chinese and Spanish, totally different languages. And unless someone's bilingual, knowing both ASL and English, this method just doesn't work. And also, how comfortable would you be just writing notes back and forth with your clinician, never really being able to communicate? And what if you were prescribed a medical device that you really needed, and it had this special alert system to notify you if your glucose went too low, and it was starting to alarm, and your glucose was getting dangerously low, and your life was on the line? And it worked for everyone, but just not you. You see, our healthcare system has built in these audio alerts, but they don't work for everybody. We need tactile alerts that have vibration. We need visual alerts that have flashing lights. This is just another way the healthcare system fails deaf people. There are 37.2 million Americans living with diabetes. That's roughly 1 in 10. And deaf people are 3 times more likely to report that they are living with diabetes compared to someone who is hearing. There are a lot of deaf people living with diabetes, and we need to address this disparity. At the University of Utah, I'm the medical director of the Intensive Diabetes Education and Support Program. This is a small group intervention where we provide this multidisciplinary care for people living with diabetes. This program significantly improves hemoglobin A1C. This is a measure of glucose. It also improves this diabetes distress measure, which is this concept of burnout or, I just don't want to do diabetes today. And it also improves self-care behaviors such as checking your glucose or taking medications. This program was initially developed in English for hearing people, but we knew that we could expand to other languages. And so we sought to redesign this for deaf individuals. We convened a 10-member National Community Advisory Board of citizen scientists. This is a racially and ethnically diverse group of people who are living with diabetes, have type 1 or type 2, and they live across the United States, and they're all focused on improving healthcare. So what exactly is a citizen scientist? Well, it's typically a person who's not classically trained in research, but they can help conduct research by helping with the design. Sometimes they collect data. They might be able to analyze the results in the context of their community, and they can also solve problems. In the disability community, there's this saying, nothing about us without us. And working with deaf citizen scientists allows us to really co-design the best way to deliver diabetes education to the deaf community because it's with the deaf community. Citizen scientists told us that they needed a visual way to understand diabetes. Oftentimes, we just tell people about diabetes and we don't have enough visual representations. And when I talk about visuals, this might mean a new visual every couple of sentences, and it might mean a new visual every few words. And so there's this really important saying that deaf people, they hear with their eyes. And so having these visuals that can support concepts, so important and crucial. Another thing we learned from citizen scientists was that they wanted to learn from other deaf people. They don't want to have to go through an interpreter. And just think about that for yourself. How would you feel getting medical information through that telephone line? You really want to be able to get that information right in your language. And so they wanted a deaf person who was an expert in diabetes care, or a CODA like me, someone who really culturally understood the deaf population. The other thing that was really important was decreasing noise or visual distractions. A lot of times when there's an interpreter in the room helping to deliver some sort of education, the person is going from visual to clinician to interpreter, and their eyes keep having to go back and forth. But in this visual, you can see that there's pictures, and then there's an interpreter right next to them. And this is how we've designed our video content and also our live presentations. That way that someone's eyes only have to move in a small space back and forth. One thing that's really important is the importance of closed captioning, and not just for the deaf person, but for the care partners as well. Because care partners who are family members and friends, they vary in the deaf population. Deaf people are most likely to marry another deaf person, but their parents, their children, and their siblings 90% of the time are hearing, and they'll have varied sign language ability. And because of that, we need to make sure that they're also understanding the content, because diabetes is managed in this social context. And so primarily delivering in sign language while also providing closed captioning allows us to include those family members. Because we convened this national group of citizen scientists, we really had people who were telling us, there's this different way we say diabetes here or here. And if you think about it, that's how we do it in English too. In Utah, we say diabetes, but down south, we might say the sugar. And so there are regional signs as well. So to unify signs, our citizen scientist team, and we had some amazing collaborators. We had a certified deaf interpreter, a public health expert who was deaf, and also our research team. We all convened together, and we decided we need to clarify some signs, we need to add some signs. And so in the end, we developed this ASL glossary of diabetes terms, and also expanders. Expanders are little bits of information that help people understand what those signs mean. And so you can see this sign here. This is the sign for insulin in the body, but we needed different insulin signs for medication based on how it's delivered. So if it's injected, if it's a pen, if it was an insulin pump, or if it was inhaled. We had different signs to support how that is visually looking and how that's administered. Our citizen scientist team has been fed up with going to the clinic and not having interpreters understand the diabetes terminology. And they really wanted us to create an ASL interpreter training that provided CEUs. And so doing so would address all the systemic barriers that they experience when they go into their clinic. And so now we're using our ASL glossary that we've already developed, and we're using that to now develop these ASL interpreter trainings so that they can learn the medical jargon. So what are the citizen scientists saying about our program? First, they are so happy to be engaged with the process. They are thrilled about making these strides within their community. They feel like they have purpose in making sure that the other people in their deaf community are receiving the best care possible. And being a part of this process has also provided them with the support system they needed to support their own diabetes. It's really empowered them, and many have improved their own glucose levels. Citizen scientists are not only helping guide our work in delivering diabetes education to deaf populations, but we're using this citizen scientist model to also support rural communities where we're delivering a hybrid telehealth program to rural primary care practices in rural Colorado. We're also delivering Hispanic interventions to Hispanic Spanish-speaking individuals that combine continuous glucose monitors with a peer support intervention because that's what they want. But our teenagers who are merging into adults, they wanted something totally different. They wanted a peer support model. There's not this one-size-fit-all. And so when we design for a population and we include citizen scientists, we can actually develop what people want and what they need. And in fact, we're exploring this process now with other communities. This is the sign for foundation. If you don't have a strong foundation to support the healthcare system for all the populations that really need to use healthcare, we're failing. So in order to serve the population properly, citizen scientists are really necessary. I get to work with the most amazing team. This work is possible because of them, and I want to thank the citizen scientists, there's 3 of them here in this picture that are highlighted, and also the research team that I work with that includes deaf individuals, CODAs, and other amazing scientists. I also want to thank our funders for making this work possible. Thank you so much.